pollen in the air, but COVID has not completely gone away. The new variant came this summer and threw us for a loop, just as we thought we were opening up and getting back to normal. And so today we're going to explore what that variant is, means, and more information about that to demystify a lot of what's been going on. I'm going to turn the program over to Larry, who will introduce the program. Thank you.
Oh, that's wonderful. Thank you, Elaine. We are so fortunate to have such speakers with such stellar credentials to share their wide and deep experience on this topic. And I'm going to do their bios, and then I'm going to give you the format. Each presenter will speak for 15 minutes, and then we'll have Q&A. So that'll be the format. So I'll tell you about each. Robert Amler, a public health and clinical physician, is Dean of the School of Health Sciences and Practice and Vice President for Government Affairs at the New York Medical College. Previously, Dr. Amler served as Regional Health Administrator of the U.S. Department of Health and Human Services. He co-chaired the implementation group for a White House Interagency Task Force on Children's Health and Safety and was Chief Medical Officer at the CDC's Agency for Toxic Substances and Disease Registry. Again, he's a practicing physician. And Dr. Shirlena Amler, a pediatrician and former CDC physician. I'll ask if they met there years ago, but that'll be later. She served as Westchester's Health Commissioner since October of 2011. She is a licensed physician, licensed registered nurse, and certified emergency manager with more than 30 years public health experience at the federal, state, and local level, including 14 years as a county health commissioner. So now I want to dive in. First, we'll start with the details of the vaccine as presented by Dr. Robert Amler. So, and then we'll proceed to specific effects on our area, which will be of note to our community in particular. So thank you, Dr. Amler, take it over.
Thank you very much. I'm just sharing slide here. And so here we are. So good morning, everyone. It's really a privilege to be invited to this group, and it's really a thrill to give you a chance to ask us some questions toward the end. So basically what I'll talk about now for the next few minutes is what's new with COVID. And sorry to say, but everybody wants to know the answer to this question going back even to January of 2020. Will this ever end? Well, since the very beginning, we have said and we have known that the real key to the conquest of COVID is this strategy. And in the beginning, it was these first two bullets: block exposure to prevent disease, because we all know if you block exposure, there can be no infection. And if there is no infection, there is no disease. If there's no disease, there are no complications of disease, et cetera, et cetera, et cetera. So the primary strategy has been to block exposure. And that's why we have harped for months now about social distancing and masks and groups not being too large, and staying, not try to crowd into a subway train and a small cafe in lower Manhattan and so forth. And this has, of course, been very difficult. It's been extremely disruptive, but arguably it has had a beneficial effect on the transmission of disease even before we had vaccine. Moving down, obviously we've had many efforts to treat the disease. I'm sure you've all had some friends who say, oh yeah, I got COVID, I had a sniffle for a day or so, or one of my children had a bad sniffle, turned out it was COVID. They were fine. They were fine. It was not so bad. And yet tell that to those of us who have had family members, close friends, even a former neighbor of mine in Georgia, of about, what I would consider not a very advanced age, who just dropped dead from COVID. And so we know this can be a horrible disease in some people. Someday the textbook will be published that will explain why some people just get demolished by this infection and other people practically just whistle on by and do fine. We don't know that, and that's really important. But in the meantime, there are treatments out there and new ones coming every day, mainly to prevent the complications, keep you out of the hospital, keep you from out of the ICU, and not going on to horrible ends. Then finally, we have the last leg of the strategy, which is to vaccinate so that we can stop this transmission and then hopefully move on with another phase of our experience with this terrible virus. Well, at the very beginning, we were not much better off than all of humanity was for centuries, always hoping for something better. You had a sick, febrile baby with a hot fever, vomiting and looking terrible. And all you could do was walk the floor with that unhappy baby. And many of us have done that as parents, hoping for something better, hoping the next morning there's a prescription or something else we can do. But until really the last slightly more than 100 years, this is pretty much all we had was compassion and love and cuddling and hoping things would get better. Over the 20th century, things got really a heck of a lot better with not just vaccines, but medications, steroids, antibiotics, hospitals, ICUs, ventilators, all of these things, better nursing care, better medical care, better physical therapy and other therapies. So, and of course, we do have an expensive healthcare system, but at least it does make a huge difference compared to this unfortunate parent who looks like she may be burying that baby very shortly. In fact, in 1900, which is really in geologic time, that is a fraction of a second for humanity and for our good Earth. 1900, half of all babies would die before their first birthday. Half of all babies would die before the first birthday. And now, even though the number is not zero, in today's world, death in a newborn baby is horrible still, but very, very rare. And that's what the difference has been. It has been technology. Just cycle back almost exactly 70 years ago to 1952 in Los Angeles. This is what people were doing. Their family members were in these iron lungs suffering from polio, which paralyzed them not only from the waist down, but from the chest down, so they couldn't breathe. And they would literally suffocate for the lack of being able to draw a simple breath. Paralyzed, not permanently, but temporarily long enough that they would die. And so these people this was the most primitive kind of ventilator that was available at the time that would basically put them in a kind of a vacuum that would suck the air out, pull the chest wall out by maybe a half an inch or an inch. And they would never get a deep breath of air. They would just get a little bit of a suck of air into their airway, just enough to get some oxygen into them and keep them going for the weeks it would take to finally recover from the virus, which some did and some did not. So what happened next? What happened next was so amazing. And, I wish we could have a superhero movie about this kind of thing, because this actually happened. We all love Superman and Wonder Woman and Spider-Man. This was real. This really happened. And for those of you who've measured things, either in cooking or chemistry, you know that 1/2 of 1 ml is a tiny amount of liquid. And yet, when it's the right 1/2 of 1 ml, it is fantastic what it can accomplish. This one in particular had a worldwide impact. This is what it looked like in Indiana once it got out, but this just happened to be Indiana. This is a file photo that I took with me from CDC. It's public domain, so it's legal. But you can see these people lined up. As you remember, just a few months ago, you saw people lining up to get tested for COVID, to get the COVID vaccine. not as bad for boosters, but people, of course, line up when they understand that this could change their fate. It could change the history of their family if key people in the family do not succumb to a terrible disease that is turning out to be greatly preventable if we do the right things. And globally, this is what half an ml did. If you compare just over the 30-year period going up to 2018, look at how polio, you can see that in the dark shading around the world. It was already gone from the US and Canada and Australia and parts of Europe, but look at how polio got just about eradicated in 30 years, just what 1/2 ml could do. So let's not forget, COVID is not the only problem. There are many other infections out there. And let's also remember that the flu is still a deadly problem. Now, we don't know how many flu cases we'll have this year. In some ways, flu is running a competitive race against COVID because it's competing for the same supply of susceptible people. When COVID went up, flu went down. Just like you get in the natural world, when one kind of tree or one kind of animal is more competitive for a certain food supply, and the other one declines a bit. But flu is still out there, and we don't know how many cases we'll have. You should definitely get your flu shot. Now, the other reason to avoid flu right now is COVID confusion, right? The last thing you want is to come down with the flu, which in a normal year, you might say, all right, I got the flu, I'll be okay, I'll probably be okay. You might not be okay, but you think you'll be okay. And many people will be okay. But the real problem is now you got to worry, is it COVID? And so you have to go down a whole cascade of problems with and questions with your healthcare provider to figure out, just what is happening to poor old Rob here, who's coughing his head off and feeling sick as a dog, but you don't know what's going on. Well, let's get now to COVID. We know that these variants have been out there. Actually, there have been many, many dozens of variants. Some say up to 100 worldwide. I haven't seen that number confirmed, but it is logical because viruses constantly mutate and they constantly develop variances. Well, what we look at, we being the public health community, is for any given variant, what's the disease severity? Does it make a worse disease? Is the vaccine still effective? Is it more or less transmissible? And does it respond to treatment as well as the good old, I hate to say good old, but the good old original COVID strain that we saw in the winter of 2020? And very important, how effective is our ability to test for that variant? All these things can change. But fortunately, mutation is not a concentrated drive to make things worse. Some mutant viruses are less transmissible. Some of them cause milder disease. Some of them are more susceptible to the vaccine and more responsive to treatment. So the CDC has characterized certain variants of interest and variants of concern. This is a quick table to show you the big players that you've heard about over the last year. But just recently, and these data are from the latest, the CDC issuance last month, these data show that really at this point, there are some earlier variants of interest, but it's only the one in dark bold, the Delta, that has turned out to be a variant of concern. And by concern, the CDC distinguishes that from a variant of high consequence. Concern is one thing. High consequence is very, very bad if it happens. This would mean significantly reduced effectiveness of the countermeasures we have in place. But currently, again, as of CDC's last review just a few weeks ago, in the US and around the world, there are no variants of high consequence. So it seems right now, this was the worst that COVID could do to us, was Delta. I find that somewhat reassuring after a year and a half of enduring this, but it does not prove we're out of the woods. We still could get other variants. Well, the final big question is, when will we get this thing that we call herd immunity? We're not a herd of cattle, but it is true that when you get enough individuals in a population who are no longer susceptible to a virus or an infection, susceptible meaning they can get sick if they get exposed to it. Once you get enough people in the population, the virus is going to run out of susceptibles. It's just going to run out of its food, essentially. There's no more place to go. It can hop from person to person, but when it lands on you, you're not susceptible, so the virus can't really do anything. And it just withers and goes away. It just dies. So lasting protective immunity is important. Saying that my friend had COVID way back last January and he got through it okay does not necessarily mean that he's got good lasting protective immunity. He may have some lasting immunity, but it's not protective. Or he may have some immunity that was protective at the time, but it didn't last. What we need is lasting protective immunity, and we get that with vaccination. For example, current deaths in the US from COVID, more than 99% of people dying with COVID are people who did not get vaccine. That was not the case back even a year ago today, right? Because there was no vaccine available at that time. Prior infection may confer some immunity, and we'll of course continue to look at that. But right now, doesn't look like that earlier infection is changing your outcome if you get reinfected all that much. What percent is sufficient? Everyone, including me, keeps asking that question. Unfortunately, we will only know it when we see it. I know that's not encouraging, but we will get to a certain point where there are enough immune people in the population that the virus will run out of places to go. It's going to run out of runway, and that's what we all hope happens soon, but we are not there yet. So in conclusion, I would just say it looks like COVID-19, COVID-20, COVID-21, and now COVID-22 will continue to be a reality. But in the meantime, all in favor of a COVID vaccine, please raise your arm like this gentle lady is doing on the screen. Thank you. And now I welcome the next speaker.
Thank you very much, Dr. Amler. Dr. Shirlena Amler, you're our Westchester County Health Commissioner. We really love for you to bring all this home to us, the county and locale, if you can.
I'll do my best. Let's see if I can find my slides. And here they are. So that's a big task, and I hope I'm up to it. So good morning, and I'm here to talk about how we're navigating COVID and the effects it's had on our community. So this first slide, let's see, I'm not sure how I can get everyone out of it so that it can be fully seen. Is there some
Actually,
way
if you click on the slide on your screen and then go up to slideshow at the top and then go all the way to the left where it says begin slideshow, that will open up the screen.
I'm sorry, I'm not seeing what you're saying.
Click on the slide itself in front of you and then go up. I'll go up to slideshow, click on that.
Slideshow.
Up at the top, slideshow. It's in the menu bar. Slideshow. No, over to the left, over to the left. Up on top where the writing is.
I know, but I don't see it up on top. It just says you're sharing.
Uh-oh. No, it's not all the way up there on top. It's on top of your slide. It's on top of what you're displaying.
Yeah, it says file, home, insert, design, and you get to slideshow. See it? Where it says file, home. Okay, but we can see pretty well anyway. Yeah, keep going to the right. Keep going, keep going, keep going. One, two more.
See, I can't see it because it's blocked by, so Rob, if I stop, can you share for me?
Yeah, I'll do that. So just stop share and I'll share.
Okay,
This will just take a second here.
sorry, technical difficulties.
Oh, but it's what we do when we have those difficulties. Thank you.
And that's the way we like it. Here we are. Okay, can everybody see this?
Oh, there we go.
Perfect. Okay, so let's.
Okay, and there you are.
All right, so next slide.
Oh, that would be me, right? Okay,
Yes.
sorry. Okay, here we are. Okay.
Okay, perfect. So this slide, which comes from the CDC's information, shows the reported COVID cases in the United States. And I wanted you to just see what has been the course of this disease, because when this first started, we had no idea what was going to happen. So as you may all remember, on March 3rd in 2020, we had our first case in this area, and it was one of the first cases where we of community spread in the country. So it was a big deal, big news. I remember getting a call from State Health Department at 3 o'clock in the morning, telling me that they were coming to New Rochelle and wanting me and my staff to meet them. They would be there at 8 o'clock in the morning for us to start our attempts at controlling what was going on in that area. So at that point in time, there were almost no cases in the US, and you can see as the year progressed, the number of cases started to increase. And so we got into August and we had this blip, and then in December, right after Halloween, and cold weather came, people started getting together. We were celebrating our usual Halloween, Thanksgiving, and Christmas. And you can see there was a massive wave of infection that occurred. And so the measures that were put in place had been, masking, social distancing, keeping kids out of school, because that's all we had. We had no vaccines. And then in early December, we started vaccinating people. And we started, of course, with the medical professionals and then the older population. And so this graph, this shows this so beautifully, back up, Robert, shows so beautifully what happened, and the fact that once we started vaccinating people, the number of cases dramatically declined. So in March, we were seeing much fewer cases. Everything looked like it was getting better. But then come July of this year, we started seeing cases again. So this blip in March was the UK variant. And then the blip that we got in July was the beginning of the Delta variant. But what made the difference and what kept this graph from really just going off the top of the chart was the availability of mass vaccination, which we started in December of 2020. And that's really was the beginning of the game changer. Next slide. So this is the reported COVID deaths in the United States. The top line, the kind of purple line, is the 75 and older population. And you can see back in 2020, when we had lots of COVID cases, the large numbers of older people who were dying of COVID. And it really was and has been a terrible disease for anyone over the age of 65. And again, when we started to really go indoors in October of 2020, started celebrating Thanksgiving, Hanukkah, Christmas, the numbers of deaths that occurred mirrored the increase in COVID cases in the country. And but if you go down and look, you know, the younger age groups, the 16 to 17, that's the dotted pink line, they did pretty well. Children did pretty well as far as deaths occurred. But really what stopped the deaths was, again, the vaccine, the mass vaccine, because we started in December, January, started vaccinating people, started with the older population. And when we started vaccines, we saw a sharp decline, a dramatic decline in the number of people who were dying. Next slide. Robert, next slide. So we can see here that vaccines really have made the difference, and they're 94% effective against COVID hospitalizations in the greater to 65-year-old group. And I mean, it's really true in everyone, but in the group that had the most deaths, that had most hospitalizations, vaccines have totally made a difference. So the blue line that you see is the rate of hospitalizations in unvaccinated people. And the green line is the rate in fully vaccinated people. And you can see that the green line is hugging the zero axis. So, you know, very few people who are vaccinated are ending up hospitalized. It's really the unvaccinated people. And if, for Westchester County, looked up the statistics for yesterday, and yesterday there were 29 people in hospitals in Westchester with COVID. Of those, 21 of those individuals were unvaccinated. So that's 72% of the people in the hospital are unvaccinated, which is roughly 3/4 of those individuals not having vaccines. So again, really, if you want to stay out of the hospital, vaccines are really the way to do that. Next slide. So what are the vaccines that are currently being provided? Well, we started out with Pfizer and Moderna, which are both messenger RNA vaccines. And then we got Johnson & Johnson. So these, with Pfizer, as we all know, you know, it was initially, like I said, older individuals, more than 18 years of age was the indication, or 18 and older, for both Pfizer and Moderna. And both these vaccines at the beginning required 2 doses. Pfizer, the second dose was given 21 days, a minimum of 21 days. It could be more, but preferred it to be sometime around 21 days from the first dose. And Moderna, it was 28 days from the first dose. And initially, Johnson & Johnson was given as a single dose. So a lot of people who were homebound, who had great difficulty getting into a hospital, a clinic, a pharmacy, got the Johnson & Johnson. Then not too long ago, we were able to start vaccinating the 12 through 17-year-olds, which was huge because this population had been, every time they had an exposure at school or at home or anywhere they went, they were out of school for 10 days. They were quarantined and unable to attend school. Lots of unhappy parents around that. But now, when they are fully vaccinated, they don't have to be quarantined from school if they have an exposure, which is fabulous. Allows kids to stay in school, do their sports, do the things they need to do. But unfortunately, the less than 12 still were not accessible for vaccines. And then on November the 2nd of this year, we got approval, emergency use authorization for Pfizer for the 5 through 11-year-olds. And so now people are starting to get their children vaccinated. Vaccines are available in pharmacies. They're available through pediatricians. We will have, at the health department, have our first clinic in White Plains this Friday. And so these vaccines are now being accessible, and hopefully this younger population will be fully vaccinated soon and won't be, again, having to quarantine if they have an exposure at school. Now, the only one of these vaccines that has full FDA approval is the Pfizer for the greater 18 and older. The rest of them have emergency use authorization, but they are fully, they are safe. They have been studied. They are safe, and we're seeing that they're safe. And in fact, we're seeing that they're really keeping people, as I said, out of the hospital, keeping people from dying. And so we would really strongly encourage people to get the vaccine. The Johnson & Johnson, once they took a look at the data, they realized that everyone who had Johnson & Johnson really need a second dose. Next slide, Robert. So we can look at boosters. So with the Pfizer vaccine, the recommendation is currently now for a third dose 6 months after the second dose. So it has to be at least 6 months since you got your second dose in order to get a Pfizer booster. It is recommended for all individuals over the ages of 65 and individuals between 18 and 54 years of age. That should be 64 years of age. I'm sorry, that's a mistake. That should be 64 years of age, who work in a high-risk area. So people who work in hospitals, nursing homes, places where they're likely to have a severe exposure. And again, I'm sorry for the mistake on that slide. It should be 18 to 64 who are in high-risk areas should also get a booster. With Moderna, it is pretty much the same. Boosters are available for those who got Moderna 6 months or more after their second dose. Again, it is recommended for all people over the age of 65 and for anyone from 18 to 65, again, that's a mistake, who are in high-risk jobs or have exposures where they would, major exposures frequently, where they would be at risk for serious disease. Johnson & Johnson, anyone who got Johnson & Johnson, and that was only approved for people over the age of 18, anyone who got Johnson & Johnson should get either a second dose of Johnson & Johnson or one of the messenger RNA vaccines. And the really good news is that now it has been improved that you can mix and match vaccines. So if you got 2 doses of Pfizer and you think, well, I would like to have a booster, but I want Moderna, that's fine, you can do it. Or if you had 2 doses of Moderna and now you want Pfizer, you can do that. For those who got J&J, they can either get a second dose of J&J, or they can get Moderna or Pfizer as their booster. So you are now allowed to mix and match, which makes a lot of people happy because there was a lot of desire to do that. Next slide, Robert. So what about here? How are we doing in Westchester? So our case numbers really mimicked the graphs that I showed you, both in the number of cases that we had and in the deaths. I mean, we pretty much just was right along with the country. And so there was great concern here for me and my staff as to what would happen, as we got into the winter months. And so we took a look at the statistics just about a week ago, and we used a couple dates that were of concern to us. So we looked at November the 25th of 2020, which was after Halloween and right around the time of Thanksgiving. And we did see a bump, as I said last year, when we got into the holidays and we got into the cold weather. So on November 25th of 2020, that day, we had 477 new cases. When we looked this year, we looked at October 25th, we had 49 new cases for that day. And I will tell you that right now we're running somewhere between this number and about 100 cases a day. Yesterday, our case count was 80 new cases yesterday. Our hospitalizations, November 25th of 2020, so roughly not quite a year ago, was 23 for that day, 23 new admissions for that day. Yes, on October the 25th of this year, it was 2. Deaths in November of 2020, that particular day, we had 4 deaths. And we had no vaccines. Nobody was vaccinated. So we did not yet have vaccines available, and nobody in the population was vaccinated. But if we look at October 25th of this year and our deaths, only 2 deaths. And where were we with our population being fully vaccinated? Well, at this time, vaccinated with 1 dose who are greater than 12, that would be the whole population greater than 12 years of age is about 91%. Vaccinated, fully vaccinated greater than 12 years of age, 81%. And I think I looked at our statistics for today, just in general here in Westchester, and for people with 1 dose who are greater than 65 years of age. So they're over 65 and have at least 1 dose. Our rates is 99.9%. So almost everybody in Westchester County who is over 65 has had at least 1 dose. For our population who are over 65 and are fully vaccinated, it is 86.5%, almost 87%, which is amazing numbers. I mean, that's really, really terrific. If I look at the population who are over 12, who have 1 dose, that's 92%. And the over 12% today who are fully vaccinated is 82%. So in Westchester, we're really doing, I think, a great job with our vaccines. And it was really showed in the number of people who are hospitalized. I mean, our hospitals have plenty of capacity because we have very few people. Like I said, yesterday, 29 people currently in the hospital in all of Westchester. Next slide. So I think that Westchester is doing a great job. I think most of our population is getting vaccinated. A lot of them are already vaccinated. Many people are in the process of being vaccinated. And so now we're actually starting our boosters. And in addition to that, we are delighted to be able to start vaccinating our younger population, the less than 12, the 5 through 11-year-olds. And I'm really encouraging people to get their children, their grandchildren, whoever you have in your family that is 5 and above, get them vaccinated because it's the best way to keep them safe. And a lot of people, unfortunately, think that children do not get COVID. They get COVID the same as any adult. If they're exposed, they have the same chance of getting COVID as any adult in Westchester. And unfortunately, they can end up in the hospital with what's called multi-system inflammatory syndrome. And there have been some deaths in the pediatric population. Luckily, not as many as in the older population, but any pediatric death is 1 too many. So now we have a great tool to help prevent deaths in our young children and hospitalizations. And so we'd really, really encourage people to get their children, their grandchildren, all the children in their family over 5, get them someplace and get them started on their vaccines. Thank you.
Well, I just want to thank both presenters and Dr. Shirlena Amler. That was wonderful information from trusted source, yourself and all your sites that we can really go by. I want to, there may be some questions from the group. We have a couple. Sean, do you have something there?
We do have a couple coming through the chat. Would you like me to read?
Please begin. And then we're going to do some short answer type things because, you know, we have our question and answer period. We like to cover a lot of topics. So and each of you, whoever wants to answer, maybe they're addressed to you specifically. Go ahead, Sean.
First, we have from Jenny Gear. Rapid tests are key to protecting those still vulnerable to the virus. Please address the role of rapid testing. What is Westchester County doing to improve the availability of rapid tests, including providing them directly to residents at little or no cost?
I'll just jump in real fast and just say, you know, testing is basically the basis of information on what is happening in our environment. And without that information, you don't know what to do next. but I'll pass to the other Dr. Amler.
So basically our testing efforts, because, we do have only so many staff and there's only so many things that we can do. So a lot of our efforts right now around testing have been to assist our schools in getting their students and staff tested. And so there is availability through the county for schools, teachers, all staff who work at schools and their students to get tested at schools. And this has been very helpful for the schools. It is kind of a surveillance. They don't test the whole population every day, but they do have the ability to test a percentage. So that is very helpful. I agree that testing is important. There are home tests that you can buy, that you can do yourself. There are rapid antigen tests. The issue with the antigen tests, unfortunately, is they do have some false positives, false negatives, a little bit more than the PCR. The gold standard is a PCR. That does take a little time. You can't get the results right away. So certainly anyone who's has symptoms of COVID, think they might have COVID, you want to get tested and a lot of doctors' offices can help direct you. So reach out to your physician. They can help direct you. A lot of pharmacies test and also provide vaccines. So there is a lot of testing out there in the community, and it is very important, I agree, in helping us control this virus.
I'm going to jump in very quickly and ask about the carriers. There's a lot of concern that maybe children, unvaccinated children, can be carriers of the virus, and people are hesitant, older people are hesitant to be in environments such as other people's homes that have young children. Can you talk about is there any risk there, and what is that?
Well, that's exactly why we have the testing program with the schools. Is part of it is surveillance, so we know what the positivity rate is, but we have a pretty low positivity rate. I mean, it's somewhere between about 1.26 to 1.55, depending on the day and who's giving you the data. But that is certainly a long ways from the days when it was 5 and 6%. So, but children do. Anyone can have COVID and not be symptomatic. It's possible. And so that's one of the reasons that being vaccinated is very, very important. If you're going to be around someone who is older, someone who has cancer or some kind of immunocompromising disease where their immune system may not be intact, even though they are vaccinated, the vaccine may not be fully protective. And in fact, before we were giving boosters to the general population, we were giving third doses to people with cancer and immunocompromising diseases to try to bring their immunity up a little bit. So it is wise if you have somebody in your family that you're going to visit for Thanksgiving, Hanukkah, Christmas, New Year's, whatever the holiday. If you have concerns, it's not a bad idea to get tested. But certainly the more important thing is to make sure that you are fully vaccinated, because if you're fully vaccinated, you are much less likely to have COVID and be able to spread it to others.
And I would echo that exactly by saying, look, the best defense is a good offense. And for the senior who's concerned about children coming for a holiday visit or whatever, the best offense is to get that vaccine. Now, the good news, as we saw in Dr. Shirlena Amler's statistics there, one of the last slides, is Westchester seniors in general are considerably better off than seniors around the rest of the country. To see that 99% of Westchester seniors over 65 have had at least one dose of vaccine. And remember, the one dose is not fully protective necessarily, but get the second dose. This is not a vaccine hesitancy issue with that population. If 99% have gotten one dose, you know that 4 weeks from now, it's going to be 99% that are fully vaccinated. So it's only a matter of time before Westchester seniors are just about fully protected. This doesn't mean that there can't be a breakthrough. There can be a breakthrough, but by, again, blocking exposure as much as you can, exercising common sense, a little bit of distancing, even at a family gathering, to the extent that you can. I always tell my friends and neighbors, don't beat yourself up about this, but let's be happy we've got the vaccine. It's protecting almost all of us. And hopefully we'll very shortly get some new medications online so that if we do, by online, I don't mean a pun, I mean meaning they're available at your pharmacy or at your hospital, that even if you get infected, if you take these medicines early enough, you won't end up in the hospital and you won't end up as a horrible statistic. Great question.
Thank you. Yeah, these are great. And
If
we
I could
have
add
more
one
of them.
other
I'd
thing
like,
to that. If
oh,
I could add
go ahead.
one
And then
last
we're going to
thing
move
to
on to
that.
some other questions too.
Yeah.
Dr. Shirley. Go ahead.
I would just say that, there are a lot of people out there who feel like just because they had COVID, that they don't need to get vaccinated, that they have natural immunity. And we know that the natural immunity from having the disease is not as robust as you get from actually being vaccinated. So anyone who has had COVID, who is, 10 days out from their disease and feeling better, feeling well, should still go get vaccinated, because that's going to provide an even more robust and lasting immunity. And that's what you really want. You don't want to take a chance that you're going to get it again. And so
I'm
really,
glad you, I think in the old TV show, LA Law, they said asked and answered, but that was one of the questions we had. So I'm glad you brought that. I'm glad you brought that. I'm just going to ask, to continue with the Sean, if there's more questions in the chat.
Sure, we have one from Ann Chodash. It says, I had the J&J and will get Moderna booster. Does the booster kick in immediately or do I have to wait 2 weeks?
well, the booster really takes a couple weeks to be fully, protected. So I wouldn't rush out to do a party, or be in a large group if you had Johnson & Johnson and it's been a while, because the immunity, unfortunately, to Johnson & Johnson really fell off dramatically after a few months. And so that's why they now, are saying, no, it really isn't a one-shot deal. You really have to have a second shot. So in that time frame, I would continue to wear masks, continue to social distance, continue to do the things you've done, and get yourself at least 2 weeks from that second dose before you do any large groups, would be my best advice.
That's great. And then, just a follow-up question on that. What is the medical science? I know that you can have a different booster from your first 2 shots, but is there medical science where it's advantageous, disadvantageous, or what? If either of you can comment on that.
Well, I can start, maybe Rob will want to join in. I mean, the reason that you have the ability to do it is they took a look at it and they said, we think this is safe, it'll be protective, and it gives people a little bit of control over what they want to do. Because there were some people, when they looked, they thought that perhaps Moderna did a little better than Pfizer long-term. And people who had Pfizer said, well, maybe I want to do Moderna. And then there may be other people who said, I had Moderna and I'd just like to try something different. I didn't like the side effects or for whatever reason. But the fact of the matter is they have said it's safe to do, you can do it. And so it's really now in the hands of the individual to decide what vaccine they want. And if you have concerns or questions, I'd say speak to your doctor. They're always the best source. They know your medical history and can give you the best advice.
Yeah, I agree. And I think many times it's a matter of practicality. Moderna is around the corner, so get it. Pfizer is right there. It's being offered, get it. Far better to get the booster dose and stop worrying about it. Just get the booster dose, let those couple of weeks, let that clock start ticking, so to speak, so that you improve your the degree of long-lasting immunity that you're trying to get.
I'm actually going to do this question from the chat, Sean. I'm just going to peruse them. Some of the other questions have been answered in this process. But people are asking, what about masks? Should we still wear them? When and where?
You know, there's a lot of anxiety about masks. I get tons of emails from people saying, you know, masks need to go away. Why are people still wearing masks? There, you know, in the beginning, if you remember, there was a lot of confusion. You know, we told people initially, you don't need to wear masks. And then it's like, you got to wear a mask and you can't go anywhere without a mask. I think that this is the answer. The answer is that there's no one single thing that we do that's going to be 100% effective. I can give you a vaccine and sure, it's the best thing out there, but is it going to prevent 100% of every case of COVID from happening? No. So what we do is we have an armory of things that we can do. These are our weapons. We can use masks. We can use social distancing. We can do the vaccines, and combined all of these things together give us the best possible protection. So while wearing a mask is not fun, I try to get different kinds of masks and make it a little bit more fun. But when I'm out and about, I'm normally in a mask because I just want that added layer of protection myself. So Rob, I don't know what you think about that, but.
Up until the vaccine era began 11 months ago or 10 and a half months ago, that's all we had. We just had masks, social distancing, and all the other, you know, the hand washing, sanitizer, and so forth. So some of us are wearing masks still pretty much all the time. Some are wearing them, let's say, socially, because you go into a place of business, they ask you to wear a mask. You certainly, if you're going into a hospital or a healthcare environment, you should be masked. This was essentially the first layer of protection that we got ourselves. And having the vaccine doesn't mean throw it away, but obviously you are much better protected behind that mask when you've had the vaccine. But there will be circumstances where you're with a lot of other people, where you're not eating or drinking, because believe it or not, somebody else on the call has had this. I've actually brought a drink up to my mouth while I had a mask on and forgot that you can't drink that with the mask in place. I'm just so used to wearing the mask. So, and that's probably happened to a few of you as well. I think wearing the mask where it seems practicable and where it seems to be sociable and you can do it and it's a little extra protection, it's fine. But remember, it's the vaccine that's made that curve change the way it has. And the only reason that last part of the curve is still going up in July and August of this year is the unvaccinated part of the population, which we can see from Dr. Amler's statistics is less representative of Larchmont, Mamaroneck, the Sound Shore, Westchester. Our population has wised up and gotten vaccinated by and large.
But I would remind you that we still have a tiny percent of our population, our children who are less than 5, who cannot be vaccinated yet. And so we still have to protect them. So if you're around a small child who's not vaccinated, you still need to wear a mask. You still need to, social distance to the degree that you can. You want to protect them. They're still vulnerable. We haven't got to them yet. We will, but we haven't got to them yet.
Okay, I'm going to just jump in because I know I can see that my president is probably asking us to do a little bit of a wrap here, but I have just these couple of questions. We are seeing a lot more travel now. We're seeing, airline rates going up, 5-6% per day. People are jumping back on those planes. So you're talking about masks. What else how safe is it to travel countrywide and worldwide? Are there extra precautions that should be taken? I can just see how anything you'll have a little pouch they're going to make clothing now with a little match pouch, a mask pouch, because we all should have it with us. But please comment on travel.
Well, first of all, I would want to know what the rates are where your destination is. I mean, you don't want to go someplace where they still have rampant COVID, and there are lots of places where that is. Secondly, you want to make sure that if you get sick, you're going someplace that has adequate hospital or medical care. I mean, my husband and I thought about taking a trip out west to a very rural area in September. And we looked at each other and said, we would be hundreds of miles from the closest hospital. Not smart, we're not going. So you really need to think about, where you're going, what the resources are there, because if you get sick there, what are you going to do? Who's going to take care of you? And, and how long is the trip? So, and when we travel, Rob and I, we've got a mask on, and we don't eat our drink from the plane unless it's a really long trip, and we've tried not to travel any more than we have to. But that's my advice. Robert?
Well, there are different types of travel. Sometimes you have to go to something that you just have to be there. And so, there's a strong reason to go. But a lot of us take pleasure trips. So we just think it'd be nice, to be out there in the national parks and things like that. It would be so nice to go, and we've been cooped up and so forth. Always think about, the benefit of the travel versus the small extra risk. And it is small, but it's an extra risk. The length of time on the plane is a factor, because the longer you're on the plane, the more the recycling of air. Now, in fairness to the airlines, my heart really goes out to those companies, because everything I have seen, and I've also consulted privately in this area for businesses like that in hospitality. The airlines, from everything I've seen, have really bent over backwards to make their cabins as clean and as re-cleaned between flights as humanly possible. I've seen videos of them, spraying down and doing all this extra work. And it's a big cost factor for them, because they have more time at the gate between flights, because it takes longer to clean the cabin. But still, the longer you're on that flight, the longer you are rebreathing air that's already circulated. But more than the aircraft itself, I think about the terminal building and the people crowded around the gate waiting to get on the plane, and the massive pileup that occurs in the aisle of the cabin as people deplane and take their luggage down from the overhead racks. We too have traveled for business a lot over the years, so we know all the drill, of getting on and off planes. But no matter what the flight attendants say to the passengers, there's always a pylon at the end of a flight, because everybody wants to get out of there. And that's probably the closest I have found myself to my fellow Americans in the last couple of months than any other time during my daily routine, is during that pileup to get off the plane, because everybody is just inches from your face. So you just need to think about that. We have family members who travel for business, and they've never had a problem. They've been real careful, and it's been fine. So travel is not an automatic infection with COVID, but think always of the benefit, meaning that you had to go for a reason, versus the slightly smaller elevated risk of getting COVID.
And get vaccinated if you're going to travel. Make sure you're vaccinated and you've got your second dose at least 2 weeks before you depart.
Right.
Excellent.
And then have fun once you get there.
All right, exactly. We really thank you. There's so many questions, right, Elaine? We can't go on and on. I just wanted to say we really thank you for this and bringing it home to our own communities. It seems like we're doing pretty well. Is there anything being done in other Westchester communities or other areas where we can learn from and reaching in order to reach populations that are more difficult to access?
I can just say generally, I've worked in all 50 states out of CDC, and I've been on the ground in all of those places. And one of the great pleasures in working in this part of New York, and particularly in Westchester, is we have either the highest or second highest educated population in the whole country. I believe it's the highest rate of college degrees in the whole country. And that has its effect, because education and knowledge and understanding and insight combine to a more cautious, more risk savvy population. And I know that it makes Dr. Shirlena Amler's job just a little bit easier because people understand what the risks are, what's at stake. And I know that my faculty and I here at New York Medical College are always happy to do these kind of events, to field questions and to speak to people in the public. And I know that applies to the health department as well.
I'm going to have to wrap up quickly because I see we're out of time. We try to promise people that we will end on the hour. We're a little over, but I wanted to thank again our speakers and thank Larry, thank Sean and Rob for pulling all this together from LMC. And also I want to invite everybody to come next month, the second Tuesday in December. That would be the 14th, when our county exec, our newly elected county exec, or re-elected county executive, will make a presentation about what's happening in the county that's going to affect us in the recent budget that was passed. Again, thank you, doctors, for all of your presentation, and hope everybody who is not vaccinated or does not have their third shot will get it soon.
Right, and Ann Bitkowski, my co-chair of the event, thanks you. She couldn't be here today, but she did plenty of work in organizing this. So thank you, Ann.
Thank you for the invitation. We just hope everybody stays well and has great holidays.
Yes.